What is the Acute Leukemia Shared Care Program? For acute myeloid leukemia. In this video, you will learn: what is the Acute Leukemia Shared Care Program? What is the treatment process for acute myeloid leukemia? How your cancer care may be shared between cancer centers.
The Acute Leukemia Shared Care Program is for patients with leukemia who live far away from the Princess Margaret Cancer Center. Shared care means your cancer care is shared between the Princess Margaret and a partner cancer center. With shared care, you get the same high quality of care without the expense and time of having to travel to downtown Toronto. At this time, there are 3 cancer centers in these regions that work with Princess Margaret to provide shared care. These are Aurora and Newmarket area, Stronach Regional Cancer Center; Barrie and Muskoka area, Hudson Regional Cancer Program; Oshawa, Ajax, and Pickering area, RS McLaughlin Durham Regional Cancer Center. Shared care may be an option for you if you live within these areas. In the future, it may be possible that Princess Margaret partners with other centers to provide shared care. What is the treatment process for acute myeloid leukemia? To understand how shared care works, it is helpful to know what the treatment plan for acute myeloid leukemia is. Acute myeloid leukemia, or AML for short, is a type of blood cancer. There are many different subtypes of AML. These subtypes may have slightly different treatment plans. This video gives you a general overview of an AML treatment plan. Treatment for AML can be a long process. The first treatment is induction chemotherapy. You will stay overnight at the Princess Margaret for 4 to 6 weeks when you get this treatment. The aim of induction chemotherapy is to put the leukemia into remission. Remission means that leukemia cells can no longer be seen in your bone marrow, and your bone marrow starts to produce normal blood cells. If your leukemia is in remission after induction chemotherapy, the next treatment is consolidation chemotherapy. If your leukemia is not in remission, talk to your oncologist, also called your cancer doctor, about next steps. Even if you are in remission, there may be a small number of leukemia cells left in your bone marrow. The aim of consolidation chemotherapy is to destroy any leukemia cells that may remain after induction chemotherapy. When you get consolidation chemotherapy, you leave the hospital the same day as you get your treatment. You may get 1 to 3 cycles of chemotherapy over 3 months, depending on your treatment plan. It is at this stage of treatment that shared care may be an option. How will your cancer care be shared between cancer centers? Before you start consolidation chemotherapy, your oncologist may discuss share care with you. You may be able to get your consolidation chemotherapy at a partner cancer center. Whether you can get consolidation chemotherapy at the partner center depends on these factors. Your induction chemotherapy did not cause you to become very ill, for example, needing to go to the intensive care unit during treatment. You have the support of a caregiver or family member to care for you at home during treatment. You have someone to bring you to and from appointments. And if the partner cancer center provides the type of chemotherapy you need. Some people may need maintenance chemotherapy after consolidation chemotherapy. Doctors use maintenance chemotherapy to keep the leukemia in remission. If you need maintenance chemotherapy, you may be able to get this through shared care. You will also have non-treatment appointments during consolidation chemotherapy. If you get your treatment at a partner cancer center, your non-treatment appointments will also be at this center. These appointments can include blood work, other medical treatments if needed, for example, imaging, blood transfusions, hydration to replace fluids in the body, treatment for problems caused by low white blood cell counts, and central line care, for example, care for a PICC line. In some cases, your oncologist may think it is best for you to get consolidation chemotherapy at the Princess Margaret. However, if your treatment is at the Princess Margaret, you may be able to get the non-treatment appointments at your partner cancer center. Your oncologist will discuss what appointments you can have at your partner center based on your care needs. Care needs can include, for example, how mobile you are or how complex your cancer is. Once you finish consolidation chemotherapy, you will continue to get follow-up care. Follow-up care can be at Princess Margaret or your partner cancer center. Where you will get your follow-up care will depend on what you and your oncologist decide. For more information about shared care, talk to your oncologist.